Hello, my dear champions. How are you today, my dear friends?
Hello, ma'am. We are good. Thank you. How are you?
I'm fine. I'm great. How are you doing?
Good.
Okay, so who will be my first guest today?
Ma'am, can I take the second one? Because we are about to break the fast.
Okay, dear. Okay.
I'll take the second one then.
May Allah accept your
Yeah,
good.
ma'am. Salam, ma'am. I can take the
Hi,
first one.
Justine. Okay, hi.
Hello, ma'am. How are you?
Hi. Yes, okay, so, okay, dear. Come on. The first task is about to appear. Okay, and here we go. This is a simulated patient task. Okay, and here it is. When you are ready to see the discharge summary, so let me know, please.
Yes, ma'am. Next page.
Okay.
Yes, ma'am. Any further page?
Yes.
Okay.
Okay. When you're ready, I will start your 10 minutes.
Okay, ma'am.
Okay, so let's go.
Hello, I'm Dr. Tasneem, one of the doctors here today. Can you confirm your name and age, please?
Yes, doctor, sure. This is Susie McDonald, and I am 51 years old.
Okay. How my address here?
Susie is fine.
All right, Susie. I can gather from your notes that you had undergone an operation. How are you feeling now?
I'm great. Yeah, I'm really, really good.
All right, that's good to hear. Okay, before we're meeting for the first time, can you tell me more about what symptoms you had which led to this operation?
Okay, do you mean the reason behind the operation in the first place?
Yeah,
Okay, yes. It was, I was leaking urine. I think it's there in your notes. It's
yeah.
my file.
Yeah. Okay, how are your symptoms now? Are they subsided?
Yeah, I think it's fine. Everything is okay.
All right.
That I have a control and it's fine.
Okay, any problem with the waterworks or bowel opening
No,
of the bowel?
no, not at all.
Okay, how's your diabetes control? Is it okay?
Yes.
Good. Okay, any problem in any pain in the abdomen or lower down below?
No, I don't have anything.
All right. Okay, do you have any other medical illness other than diabetes?
No, nothing.
Okay. Can I ask you about your social habits? Do you smoke?
I stopped smoking.
That's good to hear. Any you drink alcohol?
Only socially sometimes no.
Okay. Any recreational drugs?
No, not at all.
Okay. I am pardon. I want to ask you some intrusive questions. Are you sexually active?
Actually, not yet, but I'm planning to. I have seen somebody, over the last 3 months, even before the operation. And we are planning, to continue together. So I'm just here today, I was thinking that is it okay, so we can, you know, start our intimate relation.
All right. Okay. How's your support at home?
It's fine. I'm working, and I have 3 children, and they are all lovely and fine.
All right. Okay, Susie, it's in your notes that you have been examined by the doctor. Do you need is it okay if I examine you in the presence of the chaperone?
Yes, it's fine. If there is anything that worry you.
All right. Okay, Susie, I can see I have done your examination, and I'm sorry to say that there's a small complication which has happened in your case. Like when I examined
Okay.
you, yeah, when I examined you, the tape which was put for the incontinence, for the leakage of the urine at the vaginal epithelium, it has not healed properly.
Vaginal what?
There is the skin or mucous membrane over that tape. When we see from lower down from the vagina, it's not healed completely yet.
So why this has happened? Why I have this piece of tape become exposed?
Yeah, Susie, I can tell you what happens, we make a small, cut in the vaginal skin, and through that we do the surgery. However, it has not healed completely. The reason in your case, it could be because since you have high blood sugars, like you are suffering from diabetes and also being a menopausal, what happens, the blood supply there, it can be less, which can lead to the improper healing of the area in your case. And let me also tell you that it is one of the known complications which can happen in this surgery.
Okay, so
Yes, Susie, I can
does
understand.
this mean that I will have another operation?
Okay, I'll tell you what options we have available at this moment. Although I understand this that you are disturbed this time because you were you are free of symptoms, but now you are dealing with this complication. But we have options for this.
I actually feel fine. So what's wrong with that?
Yeah, I can tell you what happens. Like if it remains like this, there are more chances that it can bleed, it can cause infections, and it can sometimes cause problem also in the sexual intercourse in terms of the pain. Okay. So we need to treat this condition. And in your case, it's good that it is 5 millimeter in diameter only. So at this point of moment, we have the option of a local application of the cream, hormone cream. Like we can prescribe you hormone cream, which you can apply to this area. And most of the times it heals with that.
Okay.
Yeah. And during this time, we will put you on our follow-up, and that during this time, you need to abstain from the sexual intercourse until it heals properly.
Okay.
Yeah, I maybe also I will be arranging appointment with our consultant also, and which will also debrief you about the situation, and will also formulate a proper follow-up plan for you. Okay.
Okay, so I wonder maybe something was wrong in my operation. Could you please check in my notes? Maybe there was something wrong.
I'm sorry to say that your case notes are not available this time in this file. I may be also contacting your operating surgeon, and he will also held a meeting with you, and we will recheck your case notes whether there was any problem with that.
Okay.
All right. And
Okay.
what happens, Susie, sometimes this defect can be bigger, like more than we can see 1 centimeter. And in that case, if it is a larger diameter, then we need to repair it. I mean that we need to offer you another operation in case the size becomes larger.
Okay, so what are you going to do? Are you going to cut the tape?
There are two options. Either we will oversew this, skin or mucous membrane over that tape, if it is possible, without any, tension, without putting the epithelium into, tight condition. Otherwise, we can also proceed to cut the tape. However, that has the problem that it can lead to recurrence of some symptoms, like the symptoms of leakage of urine. Sometimes it can lead to its recurrence. Okay.
Oh my God, I thought that I just finished all of this nightmare and I'm not going to get this again. I was so
Yeah.
happy that the operation went well. Now you're telling me that no, it's not.
Yeah, I can understand. It's quite disturbing at this point of moment, but don't worry, we are here to help you. We will, as the size of the defect is small, we will be prescribing the hormone creams, and I will also give you some information, leaflets with you through which you can read out. And it happens in some patients, it's a complication, and we will deal it with the first line of treatment, that's the hormone cream. Okay. All right, Susan.
Okay, yes, okay.
Do you have any further questions for me to answer?
No, doctor. No, and I hope that this will be effective.
All right, I shall be providing you with the written information about this complication and how to treat it. And also we have to report this complication to a regulatory authority. That's MHRA, Medicinal Health Regulatory Agency. And I'll be just fixing your appointment with the consultant and the operating surgeon also. Okay.
Okay, that's fine. Okay, doctor.
Thank you. Thank you for seeing me today.
Okay, so your timing was perfect. Okay, you have even finished less than 1 minute before the time, so it was good timing. Your language is fine as well, and you have a sympathetic voice, okay, which is suitable for the station. Your timing also for the history taking was really good. You didn't exceed the 3.5 minutes. Okay. However, there is some comments, okay, that I would like to discuss with you. Before we do that, I would like to know what's your own feedback.
Like, ma'am, I was a little confused in the start, like whether I have to take the history of her symptoms, which she had experienced before surgery, or after, like post-op, what she complaints have. So I was a little confused about the history part. Rest examination, yeah.
Okay. Okay. So let me discuss something with you, my dear. Everything in the task will be written for a reason, right? So when he tell you that the case notes are missing, okay, that means you need to apology for that. Okay, that I'm sorry we couldn't locate your notes at the moment. Okay, and for that, may I ask you some questions, please? Okay, to know more about you. So it's simply that because of the notes are missing, this is a follow-up case, so you shouldn't take history. However, history is required, right? So they just give you this situation, so you apologize for the missing notes, and then you take the permission for taking some history, right? Okay. The first thing, of course, as we say, that this is the history of the current complaint or the present illness. Our patient, she doesn't have anything. So you asked her about how is the operation, how is the recovery, and how is the control of the urine, if there is any leaking or not, any burning sensation, any abnormality in the waterwork or the back passage, any pain. Okay, so now you're asking about the common problems that arise after the operation, right?
Yes,
So the patient give you that nothing of these. Okay, so you can ask, okay, also about further, background history about the operation, which is fine. Medical disorders. Okay, so we need to ask if she had any other medical problem, other than diabetes? How is the diabetes control? Which medication are you using for the diabetes? Any other medications? Do you have any allergy? Okay, so make sure that you exclude allergy in any station, okay? When you are coming to the point, of course, of the social history, which is very important in this case, and the support at home. Those are, you know, the main point in the history that you shouldn't have missed, okay? But
And
it's
ma'am,
only in the
recovery period. How was the recovery period? Whether she received antibiotics?
Yes, this is the first one, okay? This is the
Okay.
first, this is the first question, because she's coming for follow-up after surgery. So the first thing we ask the patient after surgery, how are you doing? How was your recovery, right? So this should be the first question. Then ask her if she is complaining of any problem after the surgery. Make sure that she is having a good control on the urine after the surgery. No pain, no hematuria, no infections, those things, okay? Then, my dear friend, when you came to the point of you want to discuss with her the finding of the examination, right? So you can just signpost. I'm not saying this is a bad news, but this is some concerning news to the patient. So the patient is coming to you. Well, she is so excited that she is going to, you know, resume her life after surgery. However, now you're telling her after successful surgery, now you're telling her that there is something wrong. Okay, so just signpost once, and then you explain to her and show some empathy that it must be, you know, some difficult situations since you are feeling that you had a successful surgery, okay, but still some problems may arise, okay, however, it's very treatable, okay, and we can manage this complication, okay, or this problem. Avoid use of jargon. That's why when I, you know, try to let you know that there's something in the jargon. It's about what is the epithelium, right?
Yeah.
So it's simply it's a lining, okay, of the private parts. It's lining of the vagina. Okay, that's simply.
Okay.
This is what, not mucosal membrane, nothing. Okay, okay. So you have made a good logical, you know, explanation of why she had this complication. It started by saying that the complication is common. Okay, however, some certain factors or some things, okay, related to the patient herself, you have discussed with her, like having diabetes, for example. Okay, so this can be considered as a risk factor for that complication, right? Your plan of management was fine, okay, but I would like you to mention involvement of the senior and reporting the complication to the MEHRA first.
Okay, ma'am.
Okay, please don't let it last. Okay, because this is the time, you know, when we are trying to draw to the patient a plan of management. Okay, we usually mention the team or the seniors that will be involved in her care at first. Okay.
Okay, ma'am. Yeah.
Okay, yeah.
Yeah, ma'am. Okay.
Okay, I think you are doing fine. Only a few parts. Okay.
Ma'am,
that
if the case notes are missing, is this incident report or?
you don't need to mention incident report or anything. You just apologize for the missing notes, and they are going to locate it for you. That's it.
Oh, okay.
Okay.
Thank you, ma'am.
Because actually missing notes, this is happen every day in hospitals. Okay.
Ma'am?
So it's just fine. Just apology and that's it.
Okay. Thank you.
So, ma'am,
Yes, dear.
ma'am, exposure is not to be mentioned in incident reporting.
This is a complication. Okay. Is that something that mistake happened during the surgery? Is that some error?
No, no, no.
Okay, but the reporting for any mesh complication is for the MEHRA. Okay, so it's mainly for the MEHRA. Look, my dear, we avoid mentioning that in every case incident reporting unless, okay, the patient complain of some neglect, okay, or some misbehavior from staff or something like that, okay? So in this case, you will highlight the importance of the investigating what has happened and to see if there is anything that have been done differently, okay? But known complication, this is not our, this is not our fault. This is a known complication, and she had some risk factor like having a diabetes, having postmenopausal, okay, a status. So this is also some contributory factors, right? Very important, my dear friend, that when you speak to the patient, okay, you be clear about the situation and about the breaking bad news, and at the same time, don't undermine your colleagues or that something wrong happened in the surgery or something, because this is, something that happened after the mesh surgery. But don't forget also about the MEHRA safety advice, please. Okay, so advising the topical estrogen, sorry, and optimization of diabetes status, okay, this is can help as well for the recovery of this patient, right? Okay, guys, so who will be my next champion today?
Ma'am, may I?
Okay, so first we do have Dr. Insha, right?
Yes, ma'am.
And Dr. Aparna, is it your name? Am I
Yeah,
pronouncing?
yes, ma'am. Aparna.
Aparna. This is a very nice name.
Thank you, ma'am.
Yes, you do have a lovely name. Okay, so Dr. Aparna, please, dear, could you please the next? Because Dr. Insha, she
No
said that she
problem.
will take the second case.
No problem,
You
ma'am.
will take the case today.
Okay.
Okay, that's lovely from you, dear. Thank you very much. Okay, so 1 second, my dear. I'm just opening my notes. Not my notes, actually. This is the book. Your 10 minutes is started, my dear. Please, come on.
Hello, I'm Insha, one of the exam candidates. I've read the scenario and I'm ready for the structured discussion. This is a case of a 62-year-old woman who has presented to us with a pelvic organ prolapse. So I will take a focused history, examine her abdominally as well as vaginally, do a POPQ assessment on her, and involve my multidisciplinary team to make a plan of management for her.
Okay, so I can see that you have an idea about the case. So specifically, I want to know what information would you like to gather concerning Mrs. Smith?
Yeah, so about the information, I would like to know about her symptoms. When did it start? What were the aggravating factors? What are the relieving factors? Also, I'd like to know if she has any bowel symptoms or any bladder symptoms. If she has any history of, if there is any evidence of stress urinary incontinence, if there is any evidence of discharge for vaginal, any abnormal bleeding. With respect to her menopause, I want to know when was it attained and was she on any hormonal replacement therapy? About her previous, I want to know about her parity, about her previous deliveries. Were there vaginal deliveries? If so, was there any use of instrumentation? And were the births close together? How was her post-operative period? And did she experience any problems? In medical history, I specifically want to know about any history of diabetes, any hypertension, any history of chronic conditions like cough, and does she have any constipation? Surgical history, especially that of any pelvic surgeries, any surgeries for prolapse previously, or stress urinary incontinence. Then any allergies, her blood group, and especially her BMI. I want to know about her habits of smoking, alcohol, and recreational drug usage. Then also, I want to know her about her mental status and how it's affecting her quality of life, and also the support at home. with respects to her post-op recovery.
Okay, so the next question is, what in particular would you want to know from her past obstetric history?
The same things that I told. What was the mode of the delivery? And if normal delivery, was there any use of instrumentation? What was the post-operative, like, what was the perpurum like? Was there any infection? Did she undergo pelvic floor physiotherapy after the deliveries? Were the deliveries close together?
Okay, so what is the examination that you would like to undertake?
Firstly, a per abdominal examination, just to just to look for if there is any masses. Then I like to do a per speculum. Firstly, I like to have a inspection, look for any excoriations, any ulcers. Then do a per speculum examination and do POP-Q assessment in her.
Any investigations?
Uh, Investigations. I would also check whether her cervical screen is up to date. And with respect to investigations, I would like to do an ultrasound. And if she has any urinary symptoms, I would like to do a routine urine examination.
Okay, so what are you, why are you going to do an ultrasound? What are you looking at?
Ultrasound to see if there is I just want to see about the uterus, if there is any mass of the uterus that has been protruding downwards, any fibroid.
Okay, so you have mentioned that you would like to do the POP-Q, right?
Yes, ma'am.
So please tell me what the POP-Q assessment is and why it's useful, and how are you going to do the assessment while you're examining the patient?
Okay. So POP-Q is basically a graphical representation of it's a graphical representation of the various types of prolapse on a chart. Its benefit is that it is reproducible, and it can give us an idea about all the different prolapse, all the different pelvic organ prolapses on a single chart. And it can also help us to assess, help us to monitor the patient post-operatively. So that is the benefit of it. Then how we do it, we basically ask the patient to empty her bladder. Then we take about 9 measurements. All of these measurements are taken with the patient with the prolapse as such, except for transvaginal length. In that, we have to reposit the prolapse back. So there are basically different points. So hymen is taken as a reference point. So it's taken as a reference point, or 0. Anything lying above it is taken as minus, and anything lying beyond it, that is outwards, is taken as plus. So different points, we have point AA, that is 3 centimeters above the hymen. Point BA, that is the most distal portion of the anterior vaginal wall. Similarly, we have point BA, which is 3 centimeter above the posterior vaginal wall, and point BP, it's most distal portion of the vaginal wall. C is the cervix, and D is the POD. TVL is the total vaginal length, and GH is the genital hiatus, and PB is the perineal body. Yes. So
Okay,
these are the different.
yeah,
Yeah.
that's good. So please look at this POP-Q. This is to Mrs. Smith, related to
Yes.
Mrs. Smith. Okay,
So
could you
according
please,
to yes.
yes,
So
please
according to
explain the nature of the POP-Q data here and the diagnosis.
So according to this, it seems like this is stage 2 anterior wall prolapse, because point AA and BA, they're both at 0. So this is stage 2 anterior vaginal wall prolapse, or in other terms called as a moderate cystocele.
Okay. So what are the management options for Mrs. Smith?
Firstly, depending on the severity of the symptoms, we always advise lifestyle management. So that is, we'd ask her if her BMI is in the higher range, we'd ask her to reduce some weight, to get the BMI under 30, to quit smoking, alcohol, to avoid constipation, take a good balanced diet, full of roughage. Then we'd also like to give her certain pelvic floor muscle training. So that would be done 8 repetitions 3 times a day for about 4 months. We can also give her an option of pessaries, uh, and there would be support pessaries in this case, and Gellhorn pessaries. Then after all the conservative treatments, if the conservative treatments are not proven good for her, then we can also give her the option of surgical management. Surgical
Okay,
management
surgical management, yeah.
Surgical management would be anterior and vaginal wall repair.
Okay, so Ms. Smith, actually, after discussion of all options, she chose to have the anterior repair. So what are the risks that you are going to counsel her about?
Okay, so about the risks, firstly, we'll talk to her about the anesthetic risks in general. Then the surgical risks would be risk of trauma to the bladder, risk of bleeding, risk of infection, risk of fistula formation. That would be a long-term risk. Long-term risk would be vesicovaginal fistula. A long-term risk would also be narrowing of the introitus, or it could cause dyspareunia, and it could also cause uh, stress urinary incontinence, or yes, stress urinary incontinence. Or again, we have to talk to her about the failure of the procedure as such. And in about 1 in 3 patients, they do require to have a secondary procedure later on in their life. So we'll have to explain to her about the recurrence of the symptoms.
Okay, so yes, thank you very much, Media. Okay, so still you have 13 seconds, but you did great. Thank you.
I
Ejaculation?
forgot the definition of
No problem, no
POC.
problem. But you have described the POCU correctly. So when you've been asked what is a component or what is a POCU assessment, so it's better to start by saying that this is the pelvic organ prolapse quantification system. This is the easiest part, right? It's a system for assessing the degree of prolapse for the pelvic organs, right? And this will help us to standardize the diagnosis, and we can compare between the case progress, pre-op, post-op, help us also in documentation and sharing the clinical finding. So you have described also about the how would you interpret the POCU score, okay? So those numbers that recorded the measure of the descent, okay? And you have explained that the hymen is a fixed anatomical reference point, and this is a 0 point, and 0 is the normal anatomic position for a side. You have also mentioned about the point AA, for example, which is will be at -3, okay, normally. Your interpretation also and diagnosis for the case based on the POCU, as this is a moderate cystocele, was fine. So it's good, of course. Okay, so here is the case. Yes, you said that the point is 0. This should be at -3. And the point BA also, what do you think about it?
It is 3 centimeters beyond point A.
Yes.
Minus.
Yes. Okay. So when you see something like this, you have made your diagnosis, and your diagnosis is fine. Okay, is correct. And how about the management? You answered that weight loss, pelvic floor exercise, physiotherapy, pessary. For her at that age, this will be a ring, okay, or combination of the above treatments. Surgical repair, it's the anterior repair, okay? And the complication that can arise from the anterior repair is bleeding, infection, pain, scarring, dyspareunia, failure of surgery to achieve desired effect, recurrence, and incontinence. Okay, yeah. So you did great. Thank you very much for your presentation. This was really fine. And we have Dr. Aparna. Hi, dear.
Thank
Yes,
you, ma'am,
ma'am.
for
Yes, ma'am.
Hi, dear. You are welcome, my dear. Okay, so are you ready for the next task?
Yeah.
Will you? Okay, that's great. Okay, so just give me a moment so I can scroll down till I reach the task. Usually, Urogynaecology module is at the end. It's nice and a small module, actually. I like this module. Okay, so here, my dear friend, this is a role play station for you. Take 2 minutes, please, for reading, and when you are ready, I will start your timer.
Okay, ma'am. Ma'am, next, please. Yes, next slide, please.
Second, I will see where is the aerodynamic study. Okay, yes, this is the aerodynamic one. It's, of course, it's very, very horrible, okay?
Yes,
So,
ma'am.
yeah, so you will try to, imagine the abnormality. I'm sorry to say that.
No worries, ma'am.
Okay.
Can I see the station, please? First slide.
Yes, okay. And instead of that, I think we can have.
Yeah, I'm ready,
Okay.
ma'am.
Okay. So 1 second, I will start my. Okay, so your timer started.
Hello, I'm Dr. Aparna, ST5 in Urogynae Clinic today. May I confirm your name and age, please?
Hi, doctor. This is Eva Gray, and I'm 56.
Hi, Eva. How are you doing?
I'm okay, doctor. But I'm really bothered by my problem, and I don't know if there's
I
any
can-
available treatment, or my life just ended like that.
I can see your worry, Eva, but we and my team are here to help you in the best possible way. As I can see that you are here to discuss the reports, is it okay if I ask you a couple of questions to understand you better? Then I can discuss the reports and come to
Yeah,
safe.
sure. Yeah, sure, doctor. Okay.
Now, thank you so much. So, Eva, can you tell me more about your condition, your symptoms?
Yes, doctor. I am sorry to say I'm leaking urine, over the past 10 months, and it's even getting worse all the time. So sometimes I leak when I have a cough or sneeze, and this will be all of a sudden I wet myself. This is very embarrassing. And this has happened since the birth of my child. So now I find myself rushing to the toilet.
Okay.
Even during meeting, I'm working in a company, and I'm so embarrassed, that I have to interrupt the meeting and just, rush to the toilet.
Okay. So, do you wet yourself also while rushing?
Yeah, it's sometimes, few times happened to me.
Okay. And do you feel any lump down below?
No,
Any pain in tummy?
no,
Any problem, pain while passing pee?
no.
Okay. Can I know the details about your previous pregnancies?
I have 3 children, all by sections, and other than that, nothing. My deliveries was fine.
Okay.
I used to leave the hospital after the operation one day, and nothing.
Okay. And what about the baby weights? Were the baby too big?
I think it was 3 point something up to 4, maybe.
Okay. So did you had were you given labor pains? Any concerns with that?
Labor pain?
Were you given pain while delivery? For delivery, were you given pains?
No, I don't remember, doctor. You know that my last child is now 15 years old.
Okay. Is it okay if I want to review your notes?
Yeah, sure.
Yeah. Thank you so much. So, are you updated with your cervical screen?
Yeah,
Okay. A few personal questions, may I?
yeah, sure.
Okay. So are you with someone currently?
Yeah, I'm married,
Okay.
but
So is it affecting
yeah,
this problem is affecting your sexual life?
to be honest, I'm not very excited to have you know, this relation, that because I keep on leaking urine and running to the toilet. So
It indeed a difficult time for you, Eva. We will help you in best possible way. And if you want, I can connect you to the psychosexual counselor with your partner.
no,
Okay.
I think if the problem of leaking urine and rushing to toilet is solved, then I will be just
Mhm.
fine.
Okay, that's good. So any medical concerns you have?
No, I don't have
Any
any.
operations in the past apart from cesarean?
No,
Any allergies?
no.
Right. And few questions on the social life, may I?
Yeah, sure.
Okay. Do you smoke or take alcohol?
No,
Pardon me for asking, drugs for fun?
no.
Okay. What do you do for a living, Eva?
Um, I am a manager of a company.
Okay. And house support at home?
It's fine. It's great.
Right. Good. And how's your mood has been for past few weeks?
I'm so worried, doctor, because of the problem that I have.
Yes, it's understandable, Eva. So what's your weight to height ratio?
I think it's 25.
Okay. Any family history of concern, especially some lump down below at early age?
No,
Okay. Thank you for the information. Anything else important you want to add on?
no, doctor, thank you. Ask it.
So Eva,
Everything.
is it okay if I examine you in presence of saffron? My staff nurse will take the pulse, blood pressure. I will see the feel of the tummy to rule out any masses, and down below whether there is any something coming lump coming down, and how you are responding. Whether there is
Yes,
any
doctor, they
urine
have
leakage.
done this for me, so I just wonder now about the report. What's in my report?
Okay, coming to the report, Eva, as I've confirmed the name, NHS number on the report belongs to you. This is, do you have any idea what urodynamic report is all about?
Yes, they told me they're trying to find what is the reason of my problem.
Okay, right. So have your GP discussed with you or anyone discussed with you the report findings?
No, doctor, that's why I'm here today.
Okay. So, Eva, after looking at your report, urodynamic is a graphical presentation to see how your water bag is behaving while you are passing urine, while
Okay.
passing pee. Okay.
Okay.
So, this shows that the muscles of the water bag is overreacting with even a small amount of urine inside it. Okay. And as I can see with the graph, when you were allowed to cough, I cannot see any water leakage at that time, right? So
Okay.
this condition is known as, with the urodynamic study done, this we in medical terms call as deducer overactivity. So have you heard about it, Eva, before?
No, doctor, I don't know what it is.
Okay. So Eva, this, as I already explained, what is it? So now I will be connecting you the team of doctors, my consultant, the urogyne specialist, the urogyne, so urology specialist if required, the specialized nurse would be there, and your GP would be kept in loop. Okay, Eva?
Okay, okay, doctor.
So for the treatment of this, as I can see that it's affecting your quality of life, we have a measurement of general measures in which taking, avoiding a lot of fluid, more than 1.5 liter, avoiding caffeine, and having a good healthy lifestyle, exercising daily, and it's a good point that you don't have any addictions. So these methods actually help in improving the results with medications, and also decreasing it happening again and again. Are you with me, Eva?
Yes, I am, doctor.
Yeah, so we have certain medications for it, and we can start with that medications. We call it as anticholinergic medications that will be given to you. But with these medications, we have certain side effects like dry mouth or a problem of constipation. For that, you will be reviewed in 4 weeks. If it's responding, you will be continued with this medication. If you're not responding, then there would be a meeting with a team of doctors to look whether there are certain further treatments like injections inside the water bag, or some further treatment like some nerve stimulation methods will be advised. Am I
Okay.
clear so far? Now, you
Uh,
also have a problem of urine leakage while cough, although it's not coming in the graph. So for that, we can teach you, the specialized nurse will teach you how to do the pelvic floor muscle exercises. Okay?
Yeah, doctor. Yes, it's fine. So, you are advising only now to take the medications, and
The general, yes.
yes, I'm afraid that I need to have a surgery. So,
See, surgery is done if you are not comfortable with the medications, okay, or you are not accepting with the injection, because with the injection, you will be requiring to put a tube inside your waterworks regularly, okay, or
okay,
you are not happy with any nerve stimulation methods, or anything fails, okay, surgery is the
okay.
last resort, okay.
Yeah.
Anything
Okay.
else you want me to address, Eva?
No, thank you, doctor. Thank
Okay,
you.
so we will be starting up with the general measures. I will be connecting you the physiotherapist as well. This is the written information leaflet. This you can go through it. This is the 24/7 number. In case any queries or any problem, you can contact us
Okay,
back.
your time. Yeah. Thank you very
Thank
much. Thank you very much. You did
you.
great. I was
Thank
worried a bit about your time management, but you have made it to the end, so it's fine. Yeah, thank you very much, Dr. Aparna. Look, my dear, only notice that your history taking was a bit prolonged. Sometimes the patient may ask you a few questions in between to elaborate, more about the information, or ask you about her own concerns. Okay, so just give a room for that. Okay, dear?
Okay, ma'am.
Okay, so yeah. So regarding the discussion, you have went through the case in a logical way. Okay, it's about the presentation, about the problem that she have, and about the other history. It was fine from you. Yes, I like it actually. And regarding the explanation of the urodynamic, it was fine also that you explained to her what is the urodynamic in the first place. And then you come to the point of what is the diagnosis of the urodynamic graph for her, which is fine. Okay, you have explained to her the medication or the management options. Non-medical part is important about the control of water intake, and about the the habits. Okay, but in order actually to give her the proper advice, the non-medical one, you need to know about her behavior, and we don't take it just by the patient history. It should be written as a diary. Okay, so if she had a diary already, so you can tell her that the incontinence nurse will be happy to review it. If she did not have a diary, she can have one. Okay, she can make a diary for 3 days. So we look into her behavior, okay? And to find out if there is any modifiable risk factor. And I can see that you have reflecting on yourself now in the chat. Yes, Dia. So please don't forget about the diary, because the diary is going to be the entry to explain the water intake and about the limit the fluid that she take and so on. Okay, then we come to the bladder training for 6 weeks. Okay, and for the part of this, she's sometimes sneeze and leak in the same time. You have explained about the pelvic floor muscle training, which is fine. When you come to the discussion of management options, so we need to enumerate the modes of the different options of the treatment by medications, okay, a group or a family of medications, or injection into the water bag wall, as you said, this is the Botox, okay, or the part of the nerve stimulation, or as the last resort is the surgery, okay. So always involve your patient in the decision making, ask her about what she think, okay, and everything will be just okay. You did a good presentation, my dear, and I believe that with a little bit of practice you will be perfect.
Okay, thank you, ma'am.
Thank you very much, Dr. Aparna. Hi, dear. You guys today was very shining. Mashallah, I can see that you are doing really great. The exam is approaching, and I can see that your level is now reaching the standard of success in this exam. So well done, my dear friends. Keep on the practice, okay? And we will have a meeting in the next session, inshallah, to practice more cases from the books. Thank you very much for your time today, my dear friends, and I'll see you soon.
Thank you, ma'am. Thank you so much.
Thank you, my dear. Thank you. Bye-bye.